This is part 2 of our health assessment, and we are working on the neurological portion of the assessment. And the first thing we're going to assess is level of consciousness. And level of consciousness is usually assessed by the Glasgow Coma Scale. It discusses response and response to stimuli. So, of course, he's awake, alert, and oriented times 5. As far as his response, because he is spontaneously alert, and when I speak to him, he can respond. So, Mr. Rankin, can you tell me what your name is, your full name?
Christopher Rankin.
Okay. And do you know where you are?
Yes.
Where are you?
I'm home.
Where's home?
Marietta.
Marietta, what state?
Georgia.
Good. And do you know what today is?
Yes. It is Monday,
Do you know what year it is?
2014.
Good, very good. So, although he's a little confused, he is a 5. He's able to be oriented to person, place, and time. Cognitive function could be assessed by asking him to say a couple of phrases. Can you say Mickey Mouse?
Mickey Mouse.
Okay, so sometimes it's not going to be a simple phrase as that, but if you give a patient a phrase with a combination of consonants and vowels, their response is what you use to determine level of consciousness. Again, the Glasgow Coma Scale can go from a 0 or a 3 to a 15, 3 being worst case, 15 being best case. Now we're going to assess the patient's eyes, and his eyes are equal, round, and reactive to light. So we'll take our pen light and we'll see if there's an adjustment to light. Yes, an accommodation is done by seeing if the pupils expand and constrict, which they did to the light. Now I'm going to ask him to follow, and we're going to see if we have any nystagmus or nystagmus or any type of gaze or drifting. Okay, so can you follow my pen? Not with your head, just with your eyes. Follow the pen. Can you open your eyes? Okay, so there were not any abnormal movements. Sometimes when a person has vertigo or is experiencing some kind of intracranial pressure, their eyes will dance on the side. When they get to the side, it'll bounce a little bit, and there was none of that. So we're going to test the cranial nerves, but I'm just going to tell you how that's done. And the way you test for cranial nerve number 1, which is the olfactory nerve, and that's the sense of smell, is to ask the patient to differentiate between smells, like coffee and vanilla. Then cranial nerve number 2 is the optic nerve, and it's a sensory nerve that tests visual acuity. And we would use the Snellen chart, the charts that they are printed, and see if they can read that. And then the ocular motor nerve, which is cranial nerve number 3, we would assess the 6 directions of gaze. So it would be right, left, up, down, and then diagonals. And for number 4, the trochlear, it would be the downward and inward eye movements. And again, we would assess the 6 direction of gaze again. Trigeminal is the nerve to scan a face. So we would lightly touch the cornea with a wisp of cotton right here and see if the eye blinks, and if the corneal reflex is such that they react properly. Also, light pain across the face. So you can do the muscles of the jaw too, and if you palpate the temples as the patient clenches their teeth, so if you can feel that to make sure that nerve is working properly. Cranial nerve number 6 is abducens, and that's the lateral movement of the eyeball. Again, that's the 6 directions of gaze. The facial nerve is for facial expression. We can ask the patient to smile, frown, puff your cheeks out, raise your eyebrows. And if they do it evenly and there's asymmetry, there's a problem, but if it's symmetrical, it's fine. You can also do taste for cranial nerve number 7. You can ask them if there's a salty taste or sweet taste, if you have something for them to taste. The auditory nerve, which is cranial nerve number 8, is the ability to hear a spoken word. Can you hear me? Spoken word. The glossopharyngeal nerve is taste, and again we ask the patient to assess, to identify flavors on the back of the tongue. The vagus nerve is gag reflex, and it also is the sensation of the pharynx. So you can have the patient say ah, and see if the patient's palate won't say ah. Yeah. The movement of the vocal cords for hoarseness is also part of the vagus response. Spinal accessory nerve is the movement of the head and shoulders. So you can ask the patient to shrug the head and shoulders, shrug the shoulders, and turn your head against passive resistance. Turn your head toward good. And then the hypoglossal is the position of the tongue. Ask the patient to stick the tongue out midline and move it from side to side. Okay, so that is how you test the cranial nerves. Now, muscle bulk. We're trying to check for muscle strength and whether there's wasting or atrophy. So we're going to feel right here. There's no wasting, definitely no wasting there. No atrophy where there's loss of muscle in any of the muscle groups. And as far as muscle strength is concerned, I'm going to have you push against my hand. Good. That would be a 5. Now we're going to perform something called a Romberg's test. And that's going to assess whether the patient can stand without leaning. And I'm going to pause the video and restart for that.